Thank you again for being here. We'll go ahead and officially begin our program today. And we want to thank you all for being here. We have, again, a wonderful set of speakers today that will be sharing some great research and data tools on health and well-being as it pertains to the IE. Next slide, Eric. And so first, I'd like to mention that this Data Summit event is brought to you by CSI-UCR and IE Rise. CSI is a research institution out of UCR School of Public Policy, focused on data and research in the IE to change our region's narrative into an asset-based one. And IE Rise is a network of organizations united in the commitment to an inclusive, sustainable, and equitable future for the IE region. If you're interested in becoming an IE Rise member and participating in monthly meetings and networking with other IE leaders, please email Damien O'Farrell at damien@parkviewlegacy.org, which is right there on the screen. And together, CSI and IE Rise not only bring you this Data Summit event, but other data initiatives as well. One of them being our IE Data Working Hub group meetings, which happen on the second Wednesday of the month from 1 p.m. to 2 p.m., where a group of leaders get together to talk about how we can build out a data hub for our region, for the IE. If you're interested in getting involved more in those conversations and those meetings, you can email myself at sarah.wright@ucr.edu, which is that email you see there on the screen. Go ahead, next slide, Eric. And the final data initiative that we have is our research portal, which was launched at our previous Data Summit event, which happened this summer, which Eric will talk to you more about. So I'll go ahead and pass it over to my colleague, Eric Calderon, who is CSI's Assistant Director. Eric?
Thank you, Sarah. Welcome, everyone. Thank you all for joining us this lovely morning. So yeah, we're just going to talk a little bit and quickly share about this research portal. Really, the intention of this portal is to house more and more data and research that's collected throughout the region. We understand that a region so large and wide, and with so many different people out here, there's many different reports, studies, publications that go on across the region. So one way in which we try to capture this is to provide a hub, a research portal that can go ahead and provide easy access for folks to go ahead and submit research that's been conducted, but also to have some quick insights, and then hopefully, again, just connect with a larger network of research and data that's available in our own hands. So this research portal does cover quite different topics ranging from health to education, to sustainability and the environment, to economic development, to transportation. So each of these submissions really just try to have a quick quote or data graph or some way to kind of capture what the report is about. And once you're able to go ahead and look into the report, you can dig deeper into a different research portal. Right here, we have a quick abstract or summary of the report, and then once we find a link it to where it's actually coming from. We do need your help. This is not a finished product. We need more and more submissions from folks to go ahead and provide more and more research, data, publications, reports that maybe even your organization has released on the IE. So you can, we'll drop the link in the chat in terms of how you can access this. You can also add or refer some reports on here. If you use a report that's handy for your fundraising or to understand your community, we would love to feature it on this portal. So please do help us out in terms of having a stronger pulse. This is just a quick questionnaire that we ask in terms of understanding the report that you're trying to submit. And from there, our team will go ahead and create an infographic for it and be able to go ahead and add any additional information on the report. So again, we're really excited to just provide more and more access to data and research for our community. And I think this is just one of many initiatives to go ahead and do so. And I'm really just excited to hear from our presenters today And of course, you can take a look on our YouTube and on our website to look at the first recording of our inaugural data summit. And we're just excited to continue this initiative. So thank you again. I'll hand it back over to you, Sarah.
Great, thank you so much, Eric, and thank you, Fatima, for dropping the link in the chat for our research portal. So we'll go ahead and continue on. So now we're going to be starting the research showcase portion of our event. You're going to hear from some amazing speakers about some recent research pertaining to health and well-being on in the IE. And we're first going to start it off. You can go ahead and continue to the next slide. Eric, we'll start it off with Gary Rettberg from CSI, one of my colleagues, our research manager, who's going to be talking about one of our most recent reports and the health data that came from that report. Gary?
Excellent. Thank you so much, Eric and Sarah. Really appreciate it. So my name is Gary. I'm the research manager at the center here at UC Riverside. So for those of you who may not be so familiar with us, we are a research center in the School of Public Policy, and we work with local community partners and organizations to produce research about the Inland Empire. You can go to the next slide. Yeah. So we find that in the region, often there's a focus on the problems or deficits that we have here, but we try to produce research that does acknowledge those problems, but also lifts up the great work that's already being done in the region, and also highlighting the need for more investment in that work. We do this a lot through our DNA framework, so that's data, narrative, and action. We use data and research to inform and craft narratives or different kind of stories about different topics. And then that work can be used to inform action by our community partners. Next slide, please. So here are a couple examples of these type of reports that you can see here. Importantly, we do mixed methods reports. So that means we marry the quantitative data to real life experiences that are happening on the ground in our community. Next slide, please. So Aquí, Estamos was a really exciting project that we got to be a part of. The Inland Empire Community Foundation created the Cielo Fund, which is a fund specifically for the Latino community in the Inland Empire. And we partnered with them to provide a data profile for Latinos in the Inland Empire. And if you look at the report, there's a ton of data about a bunch of different things. But I'm just going to show you a highlight of some of the health-related data today in keeping with our topic. So first, it's important to understand the community size that we're talking about. So according to 2020 census data, Latinos now make up the majority of the Inland Empire at 51.5%. So, we're not just talking about Latino health and healthcare, but really the health of the majority of our community in the region. Next slide, please. So as many on this call know, health is just beyond how a person is physically feeling or what illness or disease they may have. Often health issues can be traced back to different social issues or problems. And if we're thinking about the social determinants of health, it's important to note that, we see a significant percentage of Latino children and seniors living in poverty in our region. And this can have major implications for their health, how they access healthy foods, health care, and even, how they're feeling day to day living with different stressors of poverty. Next slide, please. So in 2010, 29% of Latinos in the IE had no health insurance, but this dropped to 12% in 2020, so a very large change. We also see that white residents also had a decline in uninsured rates in the past decade as well. Overall, it looks like it's probably largely due to the ACA or Obamacare expansions, different state level expansions. So definitely some progress has been made over time, but there are still some work to be done to kind of close those gaps. Next slide, please. So thinking about preventative care, which is really important, we see in all regions except for LA County, Latinos have lower routine checkup rates than their white counterparts. So this kind of further highlights the need for insurance coverage and having people be able to stay well and be healthy and not just go to the doctor when they're already sick. Next slide, please. So again, aside from LA County, which is tied, we see that Latinos have higher rates of reported psychological distress. And although the percentage differences here are a little bit smaller, it still signals the need for health and especially mental health services in our region, specifically for those underserved communities. Next slide, please. So finally, 31% of Latinos in the IE avoided applying for government benefits, and this often, includes some kind of healthcare coverage due to concerns about green card or legal status. And this shows that it's important to think of health as a holistic issue. It's not just about rates of disease or even what doctors are available, but how the healthcare system is set up and how it functions and who does and does not have access to it. It's about quality of care, healthy foods that are available, exercise, mental health. Health is everything. So to learn more about this project, you can check out iegives.org/funds/Cielo Fund. And of course, visit our website, socialinnovation.ucr.edu for more research. Thank you very much for your time.
Thank you so much, Gary. We'll go ahead and turn it over to our next presenter, which is going to be Dr. Andrea Polonijo from UC Merced, discussing the research on transgender and gender nonconforming patient experience in the Inland Empire. Andrea?
Great, thank you so much for inviting me today. I will mention when I conducted this research, I was a postdoc in the UC Riverside School of Medicine. And it would not have been possible without my collaborators, Erin Gardner from Riverside University Health System Public Health, Tommy Clinton from the Transgender Health and Wellness Center, and Brandon Brown, my mentor in the UC Riverside School of Medicine. So I led a study looking at transgender and gender nonconforming patients' experiences in the Inland Empire. We know from the literature that transgender and gender nonconforming people face experiences of stigma, discrimination, and victimization that can have a negative impact on their physical and mental health. And we also know that despite needing access to routine physical and mental health care and gender affirming treatments, that transgender and gender nonconforming people experience high rates of exclusion and discrimination in healthcare settings and face barriers to accessing trans competent care. So our goal was really to look at the data locally and identify key issues affecting transgender and gender nonconforming people in the Inland Empire region. So we looked at secondary data from the Riverside University Health System, Public Health. They conducted a transgender health and wellness survey in 2015. The survey had 90 respondents completed that lived in the Inland Empire and identified as transgender or some other form of gender non-conforming identity. So respondents used a variety of terms such as transgender, gender variant, gender queer, or two-spirit to describe themselves. About 79% of our sample was under age 50. 64% were non-Hispanic white, 46% had at least a college degree, and just over half were assigned female at birth. These respondents answered a number of questions about their physical health and their mental health, as well as about their experiences surrounding healthcare access and discrimination. Next slide, please. So this is what they had to say about their physical and mental health. When asked to rate their physical health, about 3/4 said that it was good, very good, or excellent. But despite this generally positive self-rated health, a sizable number of the respondents reported chronic health conditions. So more than 1/4 reported having asthma, high cholesterol, and or high blood pressure, and 7% reported having diabetes and or cancer. Now, in contrast to physical health, only about half of the respondents said they had positive mental health. So they said that their mental health was either good, very good, or excellent. And a larger percentage, so 68% of respondents reported that they had experienced depression or an anxiety disorder. And 3/4 reported having ever seriously considered suicide in their lifetime. So mental health was really a key concern for this group. Next slide, please. So looking at healthcare access, we see the vast majority of this sample actually did have health insurance, so 93%. Despite this, 43% of the sample said they still faced monetary barriers to healthcare. And less than half found it very easy to find a physician or a mental health care provider for routine care. Only about 1 in 6 said that it was very easy to find a provider who was knowledgeable about issues related to transgender people. And only about 1 in 3 who wanted to take hormone therapy found it very easy to find a doctor that could provide this for them. Finally, more than 3/4 agreed there's not enough providers trained to take care of trans people in the Inland Empire. These barriers to access are particularly concerning as they may exacerbate the physical and mental health concerns experienced by this population that I discussed in the previous slide. Next slide, please. So just over half of the respondents had actually disclosed their gender identity to a healthcare provider. And in terms of discrimination in healthcare settings, we found about 20% had been verbally harassed or disrespected at the doctor's office or in the hospital. 10% said that they were denied equal treatment, and 7% reported being denied service in these healthcare settings. A further 19% said that a provider refused to touch them or used excessive precautions with dealing with them in clinical encounters. And given these experiences of discrimination and issues accessing trans competent care identified in that previous slide, it looks like there's work to be done in terms of training health providers and medical staff in the Inland Empire region to gain knowledge and experience with issues relevant to the diverse needs of the transgender and gender nonconforming community, and also for ensuring that their services are welcoming and accessible for this group. So next slide. This is my last slide. So I just wanted to note that it's important to note that the experiences of the transgender and gender nonconforming community in the Inland Empire was not uniform. There were some key demographic differences that we were able to tease out of this data. And some groups came out that were really at elevated risk of experiencing health issues, facing barriers to care, or experiencing discrimination in healthcare settings. So we found that respondents under age 50 were more likely to experience negative self-rated mental health, but they were also more likely to have difficulty finding physicians, mental health care professionals, and trans competent providers. They're more likely to agree there's not enough trans competent providers in the region, and they're also more likely to face monetary barriers to healthcare. Hispanic and racial minority participants were also more likely to face barriers to healthcare compared to non-Hispanic whites, and they were less likely to disclose their gender identity to their healthcare providers. And finally, respondents that were assigned male at birth were more likely to report the providers refused to touch them or use excessive precautions when dealing with them in the clinic, and they had more difficulty finding trans competent care compared to respondents that were assigned female at birth. So in conclusion, I think the moral of the story here is that there's lots of work to be done in terms of making healthcare services in the Inland Empire more welcoming and accessible for transgender and gender nonconforming people, and for addressing their needs. And particularly with regard to serving these younger Hispanic and racial minority and transgender and gender nonconforming people that were assigned male at birth that experience disparities when it comes to mental health, healthcare access, and or discrimination. Thank you.
Thank you so much, Andrea. And of course, thank you for your work with UCR School of Medicine. Always glad to hear UCR mentioned in research and reports, so thank you. Next, we'll go ahead and move on to our next speaker. We have Jasmine Hutchinson from Loma University Health, who will be presenting on their most recent community health needs assessment. Jasmine?
Thank you so much. I'm excited to be here today to discuss our community health needs assessment, which acts as our North Star for addressing the unmet health needs of our region. Conducting a community health needs assessment every 3 years is not only a regulatory requirement for nonprofit hospital systems, but also critical to ensuring that we remain relevant and responsive to the evolving needs of our community. Loma Linda University Health's service region includes both San Bernardino and Riverside counties. This year, for the first time, we partnered with the Loma Linda University School of Public Health to collect, analyze, and report findings. In addition, we were proud to work with over 20 partner organizations to ensure that a wide range of diverse perspectives were included in our findings. These organizations provided location diversity in the high desert, Coachella Valley, San Bernardino, and Riverside areas, population diversity, including the unhoused, low-income immigrant youth populations, and ethnic diversity, among others. We were really intentional about which partners were selected and which populations they represented to ensure that there was a strong focus on understanding the needs of the most vulnerable in our community. Next slide, please. Before jumping into the specifics, I would like to share notable differences between our 2022 CHNA and 2019 CHNA findings. The 2019 CHNA was published right before the global pandemic changed life as we know it. Major changes in our findings from 2019 to 2022 included worsened mental health, worsened maternal and infant health inequities, lack of affordable housing, worsened food insecurity, lost years of education for children forced to learn virtually, many of whom may not have had access to devices, connectivity, or had the systems in place to continue to learn and succeed, higher cost of living, worsened environmental impacts from the growing number of warehouses in our region, and increased fear of violence. As we can see, there's a lot of work to be done. However, it hasn't all been doom and gloom, as there's been some very positive trends that have also emerged. There's been a stronger sense of collaboration and regional alignment amongst the nonprofit sector in the region, which hasn't always been visible. There has been a strong governmental response at all levels of government centered around vaccination and testing, as well as policies that mitigate financial losses. Our region was also the first to declare racism as a public health crisis. San Bernardino County was the first in the nation, and Riverside soon followed. There has also been an increased focus of funding from public and private institutions to invest in the IE, as well as more acceptance of virtual connections and communication. Next slide, please. Thank you. The major trends highlighted were a direct result of two primary data sources. Our CHNA seeks to weave local community voice with macro level secondary data. Using both forms of data helps us get a deeper understanding of the evolving needs and strengths of our community. Our CHNA also aims to highlight some of the amazing research conducted locally, for example, including the Spotlight on the Inland Empire, United Way's Real Cost Measure, research studies out of the University of Redlands on warehousing impacts, and of course, the work of our public health departments. Next slide, please. For the community participatory study, our process allowed us to hear from over 980 community participants in the form of community survey responses, community conversations, and key informant interviews. Half of the surveys were completed in Spanish, which is a great representation of our region. Next slide, please. Mental health emerged as a challenge in nearly every one of the key informant interviews and community conversations we held, and across every age demographic. Heart disease and diabetes remain top health challenges, according to both community voices and secondary data. Next slide, please. In addition to prioritizing these two health areas, Loma Linda University Health has also prioritized maternal and child health because of the huge disparities in maternal and infant mortality for ethnically diverse populations. There are also large regional efforts underway that aim to focus on this topic. And as the Inland Empire's only dedicated children's hospital caring for more than 800 NICU babies each year and providing high-risk pregnancy care, we are in a unique position to have an outsized impact in regional efforts. Next slide, please. While our top 3 health challenges created a framework for our health focus areas, we wanted to ensure that we focus our efforts on addressing the root causes of these challenges. We were really intentional about asking our community respondents to identify the underlying factors contributing to their top health challenges. Community members overwhelmingly directed their attention to the need for affordable housing and quality, higher paying jobs. Community members mentioned how difficult it was to access health providers, especially for mental health. Better food options, access to transportation, and safe green spaces for kids to play were also top priorities. Poor air quality with the expansion of warehouse traffic was also mentioned as contributing to asthma and respiratory problems, again, especially among children. Community members were also concerned about the number of loved ones lost to COVID-19 in the last few years and how this would affect children's mental health, especially. Next slide, please. The analysis of both secondary data and community voices led to the development of our social determinants of health priority areas, which include workforce development as our top key initiative, youth education, food insecurity, access to healthcare, behavioral health support, safe and affordable housing, access to green spaces, and community safety. These were the top SDOH factors that the community identified as being able to have the greatest impact in improving health outcomes in our region. Next slide, please. I encourage you all to check out not only our 2022 Community Health Needs Assessment, but also our corresponding implementation strategy that outlines the goals, actions, and metrics for evaluating outcomes and impact for each of our community benefit efforts during the next 3 years. We worked hard to make sure that the data and findings are visually appealing for the public with lots of infographics and photos. Thank you so much for this opportunity to share our findings.
Thank you so much, Jasmine. We'll go ahead and move on to our next speakers. We have Reverend Deborah Jones and Christopher Contreras from the Community Hospital San Bernardino, who will also be presenting their latest Community Health Needs Assessment. Reverend Jones and Christopher?
Well, good morning, everyone. Thank you to our host for inviting Community Hospital San Bernardino to present our findings from our Community Health Needs Assessment. Again, my name is Reverend Deborah Jones, and I am the Director of Mission Integration and Spiritual Care Services. And joining me today is Christopher Contreras, our Director of Strategy and Business Development. The report was commissioned by Community Hospital San Bernardino and approved by our Board of Directors in May of this year. Okay. So the report identifies social determinants of health, of which the economic insecurity is summarized in this quote from a community member's telephone interview. It takes 6 to 8 weeks and even up to 4 months to obtain unemployment benefits. Those who work events and receive tips from doing well to not making anything. They are not able to apply for unemployment and barely surviving. Christopher.
Thank you, Reverend. In the social determinants of health, we saw that unemployment and poverty ranked at the top of the list, continued by a need for free and reduced priced meals, transportation, homelessness, access to food and education, preschool enrollment and reading. Additionally, crime, violence, and air quality were also noted. To build upon the social determinants of health and what Community Hospital is doing now to help with that, we have a partnership with Mary's Mercy. There's Tabitha's Closet, as well as rideshare and transportation assistance that we're providing community members. Most importantly, at our health education center, we have a community health navigator that's able to help connect our community members to needed resources. Next slide, please.
Continuing the report, discuss healthcare access, of which the difficulty of accessing care and delayed care access highlighted in these quotes. Long wait times. Appointments are 2 months out. ED wait times can be 20 hours, and going to urgent care is faster. Access to specialist care is particularly difficult with a 6-month wait. During the pandemic, people were not going to the doctor's office and not receiving the care they needed. Christopher.
Reverend, I think we might have a slide mixed up there.
I'm sorry.
No worries. We got the right slide on the screen.
Okay, thank you. Sorry about that. The report identifies social determinants of health, of which the economic insecurity.
Reverend, I think we're good. It was the presentation slide itself. The slides,
okay.
The correct slides now on the screen.
Okay.
So for healthcare access, the quotes that Reverend Jones was just attributing to, of healthcare access, the community identified a need for health insurance coverage, regular sources of care. They also mentioned difficulty in accessing care, as well as delayed or foregone care entirely. We saw a lack of care due to cost, as well as a real struggle with access to primary care. Some of the things that community hospital is doing to build upon that and help with healthcare access is helping with food, diaper, and baby formula bank drives that we have at our health education center. Provider and insurance referrals through all parts of our system of care at community hospital, and behavioral health screenings for our intensive outpatient program. If I could ask our moderator to pull us back to the acute and chronic disease slide. Thank you. Reverend?
Okay, thank you very much. Additionally, the report addressed acute and chronic disease, of which the barriers and lack of access of healthy food is highlighted in these quotes. Barriers are related to high costs and availability of good quality healthy foods. Diabetes, obesity, and high blood pressure are not impacted by diet. Are all impacted by diet. In poor new neighborhoods, the lack of access to fresh and healthy food is a contributor to many chronic illnesses.
We saw many of these same themes arise even in our last community health needs assessment done 3 years ago. And among these acute and chronic diseases, again, poor health ranked at the top, followed by diabetes, heart disease and stroke, high blood pressure and cholesterol, cancer, and asthma and tuberculosis. Where we really see our hospital helping to meet these needs of the community is through our diabetes wellness center and our health education centers. We have a wonderful grant we're using to help with cooking, heart health, mental health, CPR classes, and more.
Okay. Next, the report cited health barriers, of which the obesity and STIs are highlighted in these quotes. There are cultural and genetic issues leading to obesity that can be passed on from one generation to the next. We have a syphilis and STI problem in our pregnant population. We need more education and testing.
Among those health behaviors, again, we saw individuals identifying overweight challenges and obesity ranking at the top. Continued community issues with access to soda and sugar sweetened beverages in abundance, where there's a disparity, on the other hand, with adequate fruits and vegetables and access to fresh produce. Physical activity and exercise opportunities, community walkability, those ranked as health behaviors, followed by sexually transmitted infections and HIV. Again, we really lean on the support of our Diabetes Wellness Center and health education centers to help imbue an abundance of resources, education, classes, some of which are free or at no cost to our community members. They'll help out with nutrition classes. Big focus in our Diabetes Wellness Center has been pediatric obesity. In our emergency department, we're creating emergency access to pre-exposure prophylaxis for potential HIV infections. Next slide, please.
Finally, the report highlighted preventative practices, of which preventative screenings are highlighted in this quote. 90% of our clients have not seen a doctor in the last year or multiple years. We also see many women ages 50 and older who have not received a breast exam.
Among those preventative practices, there's been delays or minimal access to flu vaccines, immunizations for children, minimal access or interest in going out to secure mammograms and pap smears, and also colorectal cancer screenings. So some of the ways that community hospitals helping to aid those preventative practices, we have a state-of-the-art medical imaging center, and through that we offer digital breast mammography to the community. We participate in the Every Woman Counts program, which allows individuals who financially qualify to receive a free or no cost mammogram. We're also just recruited a new surgical oncologist, so helping to build up our surgical oncology services for those individuals where surgery as treatment for cancer would help benefit them. And finally, with our last slide, just to kind of wrap us up here, both Reverend Jones and I wanted to just give thanks to, again, our hosts for allowing us to share a few words about our community health needs assessment. And if any of you need to get in touch with Reverend Jones or myself, our emails are available here for you to reach out. Thank you.
Thank you so much, Christopher, and thank you so much, Reverend Jones. This concludes the research showcase portion of our program. And again, thank you to all of our presenters for the research showcase, for sharing all of this valuable information with us. And I'm sure you're gonna hear from some folks in the chat about your reports and other initiatives that you all are working on. So great job you all are doing. We'll go ahead and move into the next portion of our program, which is going to be our data tool demonstrations. And so we have some wonderful data tools lined up for you all to see presentations from. And we'll go ahead and start with Kevin Meconis from Riverside University Health System out of Riverside County's Public Health, who will be presenting the Shape Riverside County data tool. Kevin?
Hi, good morning, everyone. I just dropped the link to our data portal, the Shape portal, in the chat as well, and I think it's in the agenda as well. So you're welcome to check that out whenever you have a chance. You could even hit the site now if you wanted to play around with it as I present this, but I will just guide you through some of the basics of the website. Want to share, looks like it's in the chat again there as well. Thank you. Go ahead and do the next slide, please. So this is just the website here if y'all want to hit that, bookmark it. And that's the basic website there. So next slide. I want to talk about the purpose of the portal, the key features, and maybe give a few examples of some things that you can go through, some of the indicators that are available there, give some examples there. So next slide. All right, so the primary purpose of this portal, we started developing this maybe, let's see, 2015, so it's been a while. We've had it out there. Not sure if anybody out in the audience has viewed the portal before, but if not, I'm going to guide you through some of the basics. So the idea was to try to improve our ability to share local health data. Obviously, at the health department, we get a lot of requests for all kinds of health data. A lot of people want, different information available by their city, by zip codes, by census tracts, whatever may be available. And so we've tried to work with this portal to develop that ability for you all to go there and get information for grants or for reports that you're working on, we're hoping this will be a good resource for you all. We have a lot of local reports from partner agencies, and if any of you all have specific reports that you would like us to put up there as well, I saw a lot of great work that was presented earlier. If you want to share those reports, and we can add those on our website as well for everyone to look at. One of the great benefits of this site is that it collates a lot of local resources as well, not just the data. So there's linkages from specific indicators. For example, if you're looking for diabetes information, I'll show you a little bit more about that later, but you can type in diabetes and see what 211 resources are available for that, what funding opportunities or maybe grants available related to that. The system, the portal scours all the funding sources nationally, locally. It's got a huge amount of data there. So let's see the promising practices as well. That's evidence-based research to help you design potential programs that may benefit from some of the research that's there, so you don't have to reinvent the wheel, so to speak. So next slide. Just some of the key features. There's hundreds of, for any of you who have been there before, you'll notice there's hundreds of health measures, and these are updated from available sources throughout the year as the data comes in to the organization that does all the data crunching for us on the back end. They have the data is updated throughout the year. So if you want to check back every few months or whatever, there probably will be new updated indicators available. So there's hospital and ED data. A lot of the best benefit, I think, is for local researchers like ourselves here. There's a lot of very detailed information all the way down to the census tract level. And I'll show you a little bit more about that. There's a lot of demographic data, and there's also a bunch of dashboards. So there's health equity dashboards, disparity dashboards. We even made like some COVID-19 specific dashboards showing some of the indicators that may impact COVID mortality and morbidity. There's a lot of mapping. And next slide. So this is the look of the home page at the moment. We're actually in the process of redesigning the home page, so some of this may change over the next couple months. But as it is right now, there are a few options highlighted here with the red arrows that I wanted to just show you the different ways that you can access the health indicator data. You can either get it from the drop down up the very top. You can hit the health data. The hot air balloon icon there will take you there as well, and also the find health data little icon down there will take you all to the same place. Next slide. So just real quickly, I'm going to take you through some of the steps that I usually use when I'm looking for data on here. The first thing I usually do is go to the hit that button there. I see a question in the chat there. Yeah, this is specific to Riverside County. So yeah, I want to clarify that. Thank you for asking. I believe San Bernardino has a portal similar to this as well. I'm not sure if anybody in San Bernardino is on the call here, but they may be able to answer that as well. But yeah, so if you go to the keyword search, this is one of the easiest ways to find data if you're looking for something specific. Next slide, please. If you type in diabetes, for example, in the keyword search and then hit enter, it will take you to next slide. It'll give you a splash screen here with all the available indicators that have anything to do with diabetes. So there's a lot of connections here: diabetes, connections with obesity, with kidney disease, all these other variables here. So the first thing I would usually do if I was looking for diabetes is just click on that indicator, which says adults with diabetes. Next slide. This will take you to the indicator overview page, which gives you, I'll just point out some of the key features here. It gives you a sort of a synopsis of why this issue is relevant, why it's important, which I find helpful sometimes if I'm trying to frame something for a grant. There's that box there. You can also select different geographies. Excuse me, for example, when you type in diabetes, it'll ask you what level of detail you want. So you can select county level detail, census, cities level detail, zip codes, or census tracts. And when you do that, it will bring you to this page here, which has, I believe I selected cities for the options. So we're looking at all diabetes data for all the census designated places within Riverside County. So I think one of the best features about this site is that it links, there's a map here, there's a distribution chart of all the data, and there's also a table below it which lists all these cities. For example, it shows you the measurement period, the source of the data, and the actual value of the most recent data point. So all these are connected. You can interact with the distribution chart up there. You can select from the map as well. It will show you which areas are the highest. For example, if you clicked on the map, it would highlight the distribution table. It would also highlight the value down below. So it's all connected. So you can quickly move from location to location, and you can also download the data. If you scroll down on this indicator page, you'll see that there's a downloads CSV option. You can download the data if you're looking to manipulate the data on your own. It also has the related content, which would be all the indicators that may be of interest, as well as diabetes. Like if there's some other connected indicator, it will give you that option at the bottom of the page. And the maps are very interactive as well. You can expand it and do all kinds of manipulation with that as well, which I won't show you right now. But let's see, next slide. So back to the community health dashboard page. We went through the keyword section, but there's also a large interactive button here that if you push on CDC places, this is one of the more widely used features that I use personally. You click on CDC places, it gives you a huge amount of data. Next slide. From the CDC Places initiative, which described a little bit above in that dialog box there. It's very detailed data, a huge amount of indicators that they've collected for 500 cities across the US. And for example, I chose Moreno Valley here, and this will give you, when you select a specific city from this drop down here, it will give you all of the available indicators for that city, which is nice if you're looking to do some type of community health profile, for example, for a specific location. You can quickly put together all of the data for that area. So you can see as well on the, real quick here, on the indicators that it gives you a bunch of benchmarks, comparisons. You can look at how the data compares to other places in the US, California, how that measure is doing, how it's been, whether the value is increasing or decreasing. Real quick snapshot, and then obviously you can click on the individual indicator and it'll take you back to that indicator page that I was showing you earlier, if you want more details about that specific one. Next slide. And then there's also, there's a bunch of other things on here as well, but I'm just highlighting some of the ones that I use more frequently. There's a health equity dashboard. Next slide. Sorry, next slide, please. So this is the health equity dashboard, which again, you can select the geography you're looking at. Some of the geographies with the larger geographies have more robust data. But some of the smaller areas, I think there was a chat question about the rural areas. Excuse me, a lot of the data is available for rural areas. If you get down to the census tract level, there is pretty good coverage for some of the variables across census tracts, and then also some of the smaller census designated places, which would be communities recognized by the census that aren't necessarily incorporated. You know, areas like, I'm just trying to think one off the top of my head, but there's a bunch of them. But anyway, let's see what else on this table. So if you go to the next slide, you can see this is an example of a health equity indicator, and the indicator page here gives you the option to look at, you can toggle these on and off. You can look at gender and race, ethnicity, whatever breakdowns are available. You can have the ability to look at those. And then one of the nice features is that they've done some statistical testing where the red bars are statistically worse. The green bars are statistically better than the overall value. So it gives you an idea of quickly to look at that visually to see which groups may be more affected by this particular health issue. Next slide. And the last one, I just want to show you real quick is the indicator list by location. Next slide. And this gives you a quick summary, interactive as well, of all the the vast inventory of metrics that we have here and the geography that those are available by. So if you were looking for something specific or just kind of scanning to do some research, you want to look through this table, figure out which ones are available at the lowest level that you need, and then you could go there directly off this page. Next slide. So just to summarize, there's lots of data available. It's highly flexible and interconnected with the way you're able to interact with the different features. A lot of resources are linked to the indicators that are available. There's lots of dashboards that you can even build your own custom dashboards. I haven't gone into that, but that's one feature you could mess around with, creating your own dashboards, and you could actually share a link to those with your coworkers. So there's quite a bit of functionality built in there, and if any of you ever have any questions about it, you can feel free to reach out to me directly with my contact information on the next slide. So thank you all very much, and please reach out to me if you have any questions. And I will turn it back over to you, Sarah.
Thank you so much, Kevin, for sharing that data tool with us.
It's my pleasure.
And of course, as Kevin mentioned, if you all have any questions, his email is right there. Please feel free to reach out to him. So now with that, we're gonna go ahead and turn it over to our next data tool demonstration presenter. We have Adrienne Damicis here from the Public Health Alliance of Southern California, who's going to be presenting the Healthy Places Index data tool with us, which is a tool that was highly requested after our last data summit event. So I'm so glad, Adrienne, that you could be here with us today to share HPI with us. Adrienne?
Great, thank you so much for having me. Just a moment as I share my screen. Great. Thank you for that introduction. I'm really excited to be here. My name is Adrienne Damicis. I use she, her pronouns, and I'm a data analyst with the Public Health Alliance of Southern California. Today, I'm going to be presenting on the Healthy Places Index 3.0, which is a data and policy platform built for the purpose of advancing health equity. There's a chance that some of you are already familiar with our HPI tool. If that's the case and you are brave enough to leave a message in the chat to say maybe how you've used it for your work, we love hearing from you. So feel free to do that throughout the presentation. But for those of you who are new, I'm going to do my best to give a complete introduction today. And then I'm going to provide some demos to show you how you can use the tool in your own work to access and visualize both data and policy recommendations. And I should say that while we're the Public Health Alliance of Southern California, this is a tool for the entire state of California. So a proper introduction of our organization, the Alliance is a coalition of the executive leadership of 10 local health departments that together represent more than 60% of the state's population. You can see on the slide here which local health departments that includes. We're fiscally administered by the Public Health Institute, and we're also the creators of the Healthy Places Index that I'm talking about today. I'm going to start us off by giving some brief context as to why we created the Healthy Places Index. So as many of our presenters have actually talked about today, we know from decades of research that our life expectancy and well-being are tied to the community conditions in which we live. And we also know that access to social conditions that support health, the social determinants of health, things like education and good job opportunities, healthy food and water, can vary drastically by neighborhood for a complexity of reasons. We also know that systemic racism is a major barrier to health. So communities of color in California and across the nation continue to disproportionately experience negative economic, environmental, and health outcomes due to racist policies embedded into our systems. In order to create lasting systems change, both race and place must be recognized and understood. So it's for those reasons that we developed the Healthy Places Index, or HPI for short, which is a place-based health equity tool. The HPI was originally launched by us in 2018, but we have a latest version of it, the HPI 3.0, which we recently launched in March of this year. The HPI was expressly built to highlight community assets and strengths using a positive frame that can be mobilized to implement solutions. Okay, so what is the Healthy Places Index? In short, it's a tool that maps neighborhood level data on the conditions that drive health. And it's layered with racial justice data and resources, and it provides community-specific policy recommendations, all to advance health equity. The data and policy recommendations provided by the HPI can be used to compare the health and well-being of communities, identify community conditions at the neighborhood level by quantifying the factors that shape health, and it helps support communities and leaders to turn that data into actionable solutions. The HPI provides many communities, leaders, policymakers, and others with the tools they need to identify inequity, prioritize equitable investment, and advocate for communities with sound, validated data. Today, I'm just going to give a really brief overview of how the HPI is constructed. So it scores and compares neighborhoods across the state based on how healthy the local social conditions are. It does this by evaluating the relationship between 23 key social drivers of health that are tied to life expectancy at birth. It then produces a score representing the relative rank of community conditions in a selected area and compares it to all other such areas in the state. And this can be done at a range of geographies, including census tract, zip code, city, unincorporated areas, congressional districts, counties, as well as others. The data and policy recommendations that make up the HPI are organized into 8 key policy action areas that are listed here on the slide. This is a somewhat deeper dive into what actually makes up the HPI. So we see here those same 8 key policy action areas, and then the 23 indicators that make up the overall Healthy Places Index. Underneath each of the policy action areas names is a domain weight. That is the weight used when calculating the overall HPI score for like how heavily that domain is weighted into the total score. That's a really quick introduction of the methodology used to calculate the index. We have a really in-depth description of our methodology in our technical report that you can download for free on our website. And I'm happy to provide a link at the end to where you can do that for anyone who wants more information on any of this. I want to also recognize how people have used the HPI to date. So since 2018, the HPI has become a go-to data tool for hundreds of state and local government agencies, as well as foundations, advocacy groups, hospitals, and others. And it's been adopted for various uses, addressing critical community needs, things like active transportation, affordable, stable housing, food security, climate resilience. And importantly to us, it was used by the California Department of Public Health to create a health equity metric that heavily influenced COVID funding and support in the state of California. We're proud to say that it has been used to inform the distribution of over $1 billion to community-focused investments, including $272 million during the COVID-19 response, specifically to communities that were most impacted by the pandemic. Before I go into the details and demonstrations of how you use our tool, I also want to highlight the race and place framing of the HPI that we're very proud of. With our latest update, we intentionally updated the platform to further elevate the race and place framing and allow those who use the HPI to explore the critical relationship between place, race, and a person's health outcomes. So this update included enhanced features. I'm going to show you some of those today, and others you'll be able to explore on the map yourself after. This ability to analyze impacts of both race and place on the platform affords insight on the specific needs and conditions of each community. And that additional insight allows you to develop more equitable interventions, programs, and allocations of resources and funding. It also ensures that resources are scaled appropriately to each region. And these enhanced data and tools help communities better advocate for their own needs. So now we have kind of a laundry list of features that are available to all users of the HPI. Some of these I'm going to explore in more depth, but for now, a quick summary. Anyone who uses the HPI can access information about their communities. That includes HPI score, as well as individual indicators, detailed race ethnicity measures, including subpopulations and national origin data. You also have access to hundreds of decision support layers. That includes topics like health outcomes, housing stability, park access, and in addition, over 30 measures are disaggregated by race, ethnicity, or language where possible. You can generate relative HPI ranks within your city, county, or more to answer the question, for example, of how communities in your county stack up. You can also create custom geographies to aggregate data for communities of interest that are not offered on our pre-selected geographies. Here I list some of the newer features and enhancements with our latest update that you also have free access to on our platform. You can now compare data across geographies and time periods, so you could track improvements or declines in a community over time. You can examine the link between race and place in several ways. You can assess how measures vary by race, ethnicity for those disaggregated indicators. You can explore race and ethnic demographics of communities you live in and work in. You can filter geographies by race and ethnicity or country of origin to identify small or geographically dispersed populations and where they're located. You can also receive policy recommendations that are tailored to the specific needs of your community, helping support moving neighborhood data into action. And you can view historically redlined neighborhoods. Okay, so I'm going to go into a deeper dive of some of these functions. I'm not going to get to all of them today, but at the end, we'll also provide the link for the map and you can explore these features on your own. So the first one that I want to talk about more in depth, though, is accessing information about your community. Community can be defined as any geography on our map, from census tract to school district to county. With the HPI map, you're going to be able to not only see the HPI score of your community, but also investigate the individual HPI indicators within their policy action areas. So just using the community conditions panel alone, which I'm going to show in a moment, you're going to be able to see how your community compares to other California communities, what factors impact health in your community, and the equity impacts and outcomes. So to access information about your community, you just simply click on it and the community conditions panel will automatically open. We can see that this Lake Arrowhead census tract has an HPI percentile of 16.1, which means it has healthier community conditions than only 16% of other California census tracts. At the top of the panel, I can easily see how this census tract compares to the city and county it's located within. Scrolling down, you can expand each of the policy action areas to reveal the indicators within them and see how your community fares on any one of these indicators. If you want to know more information about one of these indicators, you can click on the right arrow next to its name, like I'll do here for the voting indicator. This will open a panel with detailed information about how your community fares on this specific indicator, as well as its comparison to the city, county, and state. You also can see the technical definition for the indicator, its connection to health, policy opportunities related to it, and the data source. Going back to the community conditions panel and scrolling past those policy action areas, you can also access detailed race and ethnicity information about your community. That includes detailed information on ancestry, so you can expand and see those subpopulations for your community as well. At the bottom of the panel, we also include several priority equity indicators, including whether or not the census tract was historically redlined. I'm also just going to show how you can reload the map to display any geography of interest. So I'm looking at census tracts right now, but you can instead choose to view zip codes or maybe your county of interest. But there's plenty of other geographies available as well, so you can play around with what your specific interest is. Lastly, I just want to show that you can also search a location. So if you don't want to find it on the map, I am going to search up the city of Riverside and it will pull that up for me. And it now shows all the information for Riverside in that community conditions panel. In HPI, we also have a set of supplementary data layers that provide important context alongside the HPI score. We call these our decision support layers. So among others, these include measures of projected climate change exposures, vulnerable populations, adaptive capacity, health outcomes. There's over 375 of these layers available, as well as including multiple years of data and stratifying the data by race, ethnicity, and language where it's possible. So with these decision support layers, you could see how your community fares on a number of individual measures outside of our HPI score, such as health outcomes, housing stability, park access, etc. To access these, you're going to select the View Indicators function in the Tools menu. Up first, you'll see the HPI policy action areas, which you could expand to view the individual HPI indicators. But below that, you can see our many categories of decision support layers. So you can just expand a topic area and view a specific data layer on the map simply by clicking the button next to it, like I do for median home value. The map will refresh to now display that data. Today, I'm briefly showing just a few of the data layers available, such as preterm birth rate. But among the data available, we've also included measures of equity, diversity, and inclusion, climate change, linguistic isolation and other demographic characteristics, schooling, students, and proficiencies, as well as many other health outcomes that I didn't highlight today. Just as I showed before, you can learn more about any one of these data layers by clicking the arrow next to it. We also have a set of supplementary data layers called overlay layers, which are listed after our decision support layers. So they're the bottom of the View Indicators panel that I'm scrolling to now. These are primarily point or boundary layers that you can view over top the HPI map or whatever indicator is displaying. So in this example, I can see where public schools are located or locations of public housing. The next feature that we're going to discuss is the rank by geography feature. So by using this, you're able to calculate the relative rank of any geography within a larger geography. For example, if you're a county health department and you wanted to see the breakdown of HPI scores amongst your county alone, you could use the rank by geography function. It allows you to compare neighborhoods to each other and call out the highest ranked and lowest ranked census tracts in your community. To use this, you're going to go back to that tools menu, but this time you'll select the rank geographies function. First, you're going to need to choose the geography that you want to rank. So I'm going to do an example where I rank census tracts in San Bernardino County. So I'll select census tracts as the geography to rank, and then I'll search for San Bernardino County as the geography that I want to rank within. Once the rankings load, you can either view the census tract ranks compared to California, which is just the default setting of our map if you're looking at the California map. But in this case, I want to select the rank percentiles compared to San Bernardino County. Now I'll see a within county or relative rank as displayed on the map. You also get a complete list of the San Bernardino County census tracts from healthiest community conditions to least healthy community conditions, or you can resort that to show those with the least healthy conditions on top. And then very importantly, you also can export this list as a CSV file and save it to use in your work. The example I demonstrated today is ranking HPI score for your specific geography, but you can also use this feature with any of the decision support layers available on our map. The HPI score is only one way to find neighborhoods in California. You may also want to identify neighborhoods based on specific criteria. So if you're a community organization that's specifically working to improve access to healthcare, for example, you might want to find communities that are both below a certain HPI score and have low rates of health insured adults. So for situations like this, we have a filter by indicator function that lets you select any number of different criteria to pinpoint specific geographies for your program or resource. To do that, you're going to go to the tools menu yet again, and this time you're selecting filter by indicator. You can either filter indicators by percentile ranking or by the actual indicator value. In this case, I'm going to use percentile ranking, and I'm looking to see all tracts that are below the 25th percentile for HPI score and below the 25th percentile for the insured adults indicator. In these examples, I used the text box to edit what range of percentiles I'm looking for, but you can also drag the slider. The map will automatically reload to show only census tracts meeting the criteria that I've set. And then you can see in the top right corner, the legend will reflect all active filters that are displaying on the map, so you know exactly what it is you're looking at. If you wanted to remove all those active filters, we do have like a refresh button that resets all of them back to the default setting. The next feature that I'm going to get to demo quickly for you is our filter by race ethnicity function, which lets you identify small or dispersed race and ethnicity populations. This level of detail on race, ethnicity, and national origin is important, especially if you belong to a community-based organization or an advocacy group that serves a specific or small population. We have the feature specifically designed to help you find your priority communities. It's called the filter by race ethnicity function, and this can help answer questions such as, how do I identify communities where my priority population is most likely to live? So to use this one, this time you're going to select filter by race ethnicity from the tools menu. So it's separate from the filter by indicator. You can filter geographies either by race alone categories, which are mutually exclusive race and ethnicity categories, or by race alone or in any combination. This allows you to identify, for example, the entire population that identifies as Native Hawaiian Pacific Islander, which is what I'm doing in this example, even if they also report other race identities as well. This might be preferable to identify certain small race ethnicity categories that otherwise tend to be undercounted or overlooked. You can adjust the threshold to change how sensitive you want the filter to be, either by total population count or percent of the population. So I made a change for it to show me any census tract where 50 or more people are Native Hawaiian or Pacific Islander. The map refreshes to only show those census tracts meeting that criteria. I also want to point out that we have very granular race and ethnicity options. So I chose to look at all Native Hawaiian Pacific Islander populations in this case, but I could have narrowed it down just to the Samoan population if that was what my priority population was. I think this is the last feature I have time to highlight today. It's our policy guides. We have very extensive policy guides included in the HPI that you can access actually on their own website in full, but they're also embedded into our MAP platform. These help people take our data into action. We think that our policy guides are a great resource, but it could also be challenging to identify which actions to take in your specific neighborhood or project area. So we've built into our map, our policy guide content, and a tool that elevates the policy opportunities that may have the greatest impact in your selected community. So to access the full policy guide content, you can go to the tools menu and select policy opportunities. You can click through all of these here and explore them in greater depth, learning their connection to health, some quick start ideas, individual policy actions that you can take. Alternatively, you can select a community first and then go back to our tools menu, which I'm going to display in just a minute. So if I have a community of interest, I can click on that first, go back to the tools menu, and now select that same function, policy opportunities. This time the map actually highlights those policy opportunities that may have the greatest impact in this specific neighborhood based off of the neighborhood level data. It's an excellent way to find ideas for actions in your community and allow you to explore them further. I think that's all I had time for today, but I believe we still have time for a Q&A session. I'm happy to answer questions, and I also want to put this up on the slide. There's links here to our website, a direct link to our map tool. There's also a link where you can request an API key if you want to download our data. And the email provided there is the perfect one to reach out to us if you have any questions about working with us or the HPI. So you can also send your questions there. But in the meantime, I'm happy to answer some questions.
Perfect. Thank you so much, Adrienne. And as you all can see, there's so many layers to this tool. So feel free to ask any questions during this time. You can drop your question in the chat, or if you have a question that you like to ask out loud, you can use the raise your hand tool and we can unmute you so that you may ask your question. I see mentioned in the chat, Carolyn has shared the way that her organization, Arts Council of San Bernardino, has used HPI. It's a great example of that. Jasmine also pointed out that there's a lot of great indicators here at this tool to give us like a full snapshot picture of things that we may want to look at. Any questions at all or anything to add to those comments?
I'll just add quickly if there's no more questions rolling in. First of all, thank you so much for having me. And I also threw a lot of new information at you very quickly. So as you're absorbing it and playing around with the map, we would love to hear from you. We do highlight a few things on our website. So anybody who's utilizing the HPI in their own work, we really love to hear from you. We have a form where you can submit that information to us, and we like to highlight your work on our website. We also are really open to your feedback and suggestions. We are, I can stop sharing. We're very open to your feedback and suggestions. Many of the updated features and enhancements and data layers we have came from focus groups with community organizations or just general user feedback. So anything you have for us about how to better address the needs of your communities or how we can better display our data, we love to hear that feedback from you. And the email that was provided is the perfect one to reach out to.
Perfect. Thank you so much, Adrienne. And there's Adrienne's email as well. And of course, she shared the other email too, if you'd like to get in contact with anyone at all from HPI. But thank you so much, Adrienne, for this presentation. Is well appreciated. As I mentioned, this was the most requested data tool from our last data summit. So we're really glad that you were able to join us today and share this information with us. And with that, we're getting close to time. So we'll go ahead and wrap up. I'll say again, thank you all for coming. Thank you all to all our presenters today, our research showcase presenters. Thank you to our data tool presenters. And I'd also like to thank my colleagues at CSI, and of course our partner Damien from Parkview Legacy Foundation for the partnership with IE Rise. Eric, if you can go ahead and go to the next slide. I have one more ask of you all before you log off. We have an event feedback survey, which Fatima just dropped into the chat for us all. We love to get your feedback on this event. We like to do more of these events, and we're always looking for ways to improve these events. So please feel free to fill that out. It's very short. I promise it'll take you 5 minutes. It's quick and easy. So feel free to provide any feedback on how we can improve these events, and also for future topics that you would like to see at our next data summits. Also on the screen, you see my email again, if you're interested in joining the Data Hub working group sessions, and Damien's email if you're interested in joining IE Rise. So thank you all again. Thank you for coming. Thank you to our presenters for making this next Data Summit event a success. And we can't wait to see you all at our next Data Summit.